Hi everybody, welcome back to part 2 of the gastric bypass surgery 9 years later, the good and the bad. Here's a few pictures. The first one is my wife and I the morning that we left for gastric bypass surgery, and then the second picture is after, 9 months after approximately, same pose, and then some other pictures thrown in for good measure, enjoying some of the activities that the gastric bypass, the weight loss, has enabled us to do. Enjoy. So the 9-year road has been a good one. Only until recently did I really suffer from a side effect. Well, actually, the side effect started probably about 2009. Reactive hypoglycemia, which is late dumping syndrome, which is what I get. I'll talk about that later in another video, but the good parts totally still make it worth it. You can see we were pretty robust there in those before pictures. My wife and I always participated in athletics, bowling, if you want to call that a sport, but softball, bicycle riding. We loved bike riding. When we met, we were both riding bikes, and after marriage, which is when we started gaining our weight, we became homebodies, and I'm an amateur chef, and I worked in the worst place you could possibly work when you're trying to watch your weight. I worked for a fresh pasta company, delivering fresh pasta to all the fancy restaurants in Los Angeles and Orange counties. Specialty order pasta, so every restaurant I went to, usually a special order. The chef, I would have to deliver it off hours usually, and it could be the dinner hour. Well, they were so grateful I got their order there to them. On the way out, here you go, have some meatballs, have a sandwich, pizza, try this pasta dish. Every restaurant. Well, I had 12 deliveries a day. So real quick, there was a story that I delivered to the Beverly Hilton. Special order. The chef forgot to order for a wedding the next day. Before I left, he goes, "Hey, you hungry?" I said, "Yeah, sure. How about a slab of prime rib?" I was resting on the counter, just ready to be served. I said, "Hey, like an end cut?" "Sure, end cut." Baked potato. Gave me the whole fixings. I had to sit and eat it there. Couldn't leave with it. But that helped contribute to my weight gain during those years. I had shot up to 360 pounds. Well, that's when 2005, when the wife and I said, you know what, we need to do something. We were both getting heavy. We were not doing the things we like to do. Bike riding is out of the question. We were still playing softball and having fun, going to the parks, staying active, but it's very hard on the body, pushing all that weight around, hard on the joints. So that made having the surgery for both of us really improved that part. Being able to bend over and tie your shoes, better love life, all kinds of things that you take for granted. Restaurant booze, being able to fit, not be scared when friends invite you to dinner. Are you going to fit in the booth when they seat you, or you're going to have a table out in the middle of the whole restaurant? It's an uncomfortable feeling when you're sitting out there. Theater tickets, or theater seats, sports events. You fit. It's so much easier. You get to go to regular clothes stores and buy normal sizes. Don't need the big and tall or a special order or anything. That makes it really nice. My wife and I both got to our lightest weights about 9 to 10 months after the surgery. Mine was about 215. Wife was in the 150 range. Been able to maintain that pretty much throughout the 9 years. Well, 8 years. For me, this past year has been tough. I have put 30 pounds on. Now I'm back on a program. Part of the reason I'm doing these videos is really to help me too. Kind of like a built-in support group, which we still go to every month. I add that as a tip. If you've had the gastric bypass surgery or thinking about having it, do go to the support groups. Try to go at least every other month at the least. They do help keep you on track, and you learn a lot from other people going through the same thing you're going through. That's another good thing about the surgery too. Made a lot of nice friends. But health-wise, the type 2 diabetes that I had before surgery is gone. The doctor is going to actually take that off the diagnosis. The hypertension, I'm still treated for it with medication. That for some reason never got low enough to get off the meds. Maybe if I got under 200 pounds, I don't know if that'll happen. Who knows? Hopefully I can get back on my bike here, and the hand surgeries are pretty much over with. Maybe I can get back on the bike and work on it. I got close. I think I was 199 for a couple days. I think it was because I actually dehydrated on a bike ride. It wasn't that I lost fat, because I gained it back as soon as I rested up. Got back to my 205. My riding weight was usually in the 205 range. And then during the off season, I'd go back to about 215, 220, that area. And then it came right back off. And cycling training started around February. I'm not a racer. Never, my wife and I aren't racers. We participate in endurance rides. They're organized rides, 60 to 100 miles. And got to be careful after a gastric bypass if you want to take that up. Got to really watch your water, because hydrating is not that easy after gastric bypass, especially early on. Later on it becomes easier, but you need to drink the water if you live in a hot climate, and if you don't keep up on it, you get behind, you're going to head for failure. It can cause you a lot of problems. It did me. So, but all being said there, I'd still do it in a minute. No hesitation. If they said, you want a gastric bypass, I'd say, you betcha. I'll go right back in and have it done again. The joint pain is gone, for the lower extremities especially. I have hand issues. That's not caused by any side effect of the gastric bypass. But legs are fine, feet don't hurt like they used to, and everything is just so much easier. Health-wise, I did have fatty liver at the time of surgery. They noticed it when they had me. I had laparoscopic procedure done. And a little fatty liver. Nothing to be alarmed about. Hopefully that can correct itself by following the prescribed diet of our medical group. Every medical group has a different dietary approach post-surgery. Ours advocates a low-carb diet, a la Atkins, and that's what we're supposed to follow. And as long as I do follow the prescribed plan, weight stays where it should be. For me, in the 210 to 215 range, and blood sugar remains stable. It only goes wacky on me if I eat the wrong carbohydrate, and sometimes even the good stuff. Oatmeal bowl of Cheerios, out of the question. Really can't drink milk either. But the good parts still outweigh the bad. I would not hesitate, like I said, to have this done again. So next video, we're going to talk about the bad parts that are affecting me. The wife really doesn't have these issues. I'll get into what has actually cost me my job right now, for the time being. And that's the late dumping syndrome, which causes the reactive hypoglycemia. I'm a commercial truck driver, and the new regulations is what has actually caused this. They've known about the reactive hypoglycemia for about 4 years, but it wasn't an issue until this year, when the regulations tightened. And you can't have it and drive a truck at the same time. So, and I'm not saying that's a bad thing, but I need to be able to prove I can control it, and I don't know how I'm supposed to do that. So next video, I'm going to get into the side effect that I have. Alright, till next time. Bye.